Hey, hun. So, I was looking over the notes that the other nurse wrote down, and before we get started, I just want to get some other information from you, okay? Okay. If at all during our examination you feel lightheaded or fatigued or anything like that, please let me know, okay? You can stop and you can have a lie down. Okay? Okay. So I'm just gonna start with the basics, and can you please tell me your name? Your full name, please. Okay. And your date of birth? Okay. Your origin of birth? Okay. And do you know where we are right now? That's correct. So you were brought in today because you had suffered a fall, is that correct? Off your bike. Yeah. And you have a wound. It's right here. I can see, yeah. It's not that bad, thankfully. Yeah, it'll just need to be cleaned up. Yeah. So just gonna clean that up for you, and then also we're just gonna do a couple of tests for your vision and your memory and such like that, okay? And just to check all around your head and in your mouth to see if there's any other injuries, okay? Okay. So I just want you to answer me a couple of questions. They aren't going to be too hard. So, what is the name of the city that we're in? Correct. And what is your mother's maiden name? Okay. And can you count from 10 to 1 backwards? Okay, perfect. So it seems that your memory's okay for now. When you first fell and hit your head, did you feel did you lose consciousness or black out? You don't think so? No? Okay. Just hurt a lot? Yeah. Okay. So, we're just going to take a quick look at first before we clean everything up at your eyes with flashlight, and we're going to, like I said, look all over inside your mouth and around your head for any possible bumps or lumps, okay? Okay, so I'm just going to check your eyes, and unfortunately it's a bit of a bright light, so do tell me if it hurts your eyes, okay? Okay, I'm just going to see how your pupils are dilating. Okay. It's not hurting, is it? yeah, I don't want to touch your face until I put my gloves on. So. Okay. So everything seems to be fine with your vision. If you could just do me a favor, you can follow this flashlight with your eyes. Stare at my nose directly. I can stare at the wall behind me, just straight forward, and follow the flashlight, okay? It's gonna go a little bit faster now. Okay, perfect. Okay. So I'm just going to put on my gloves. It's unfortunate that you had this happen to you while you're riding your bike. Nice day like this. Yeah. Accidents can happen. Luckily you're wearing your helmet, so you didn't get any further injuries, but yeah, it just nicked you above the eyebrow. These gloves can be a little bit tricky to get on. And I'm just gonna put on a mask, just for my protection. Just for a bit, okay? Because I'm just gonna be looking inside your mouth and I don't want to breathe inside your mouth or anything, okay? Then I'll take it off. Okay, perfect. So, if you could just open up your mouth really wide for me. Just gonna take a look in. Okay. Just going to get my flashlight here to look in the back. All your teeth seem to be perfectly intact, which is always good news, right? Okay. Okay. If you could just lift your head up. Okay. So take a look at the top of your mouth, the roof of your mouth. Okay. Just going to check around your scalp now. Tell me if you feel any bumps. If anything's tender, anything hurts. I'm just gonna go through your hair a little bit here, hon, okay? Just gonna separate it. Looks looks like you're all good besides that one cut. Yeah. And you told the other nurse that you didn't have any other pain on your body, right? Just kind of sore, but it's manageable. Yeah, she took a look. Okay. Alright, well, let's get started on cleaning up that cup for you, okay? Okay. So, I don't think it's really gonna hurt much, but if it does, just gonna have to sort of bear with me, okay? Get some of my hydrogen peroxide, and I'm just gonna spray it on the swab, not directly onto the cut, and we are just going to How does that feel? Feels okay? Okay, good. Okay. So let me get another one now because I made that one a little bit dirty. Okay. Swipe. Being very, very gentle. Yeah, I don't think you'll get a scar from this. I wouldn't worry about that. So I got the majority of it, but I want to get in a little bit deeper, yeah. So I can just clean it up real good and put a nice band-aid on it. Okay. Good here. Yeah, it's normal for it to get a little bit bubbly like that, and it's just really getting in there, deep cleaning, getting out all the dirt, bacteria. It's very good that you came to the hospital, because, things like this can result in infection and worse off things, right? Okay, so the wound looks all nice and clean. So I'm just going to grab a bandage, okay? So just sit tight and I'll be right back, okay? Okay, so I'm back with the bandage, and I'm also going to be applying this antibacterial cream, okay? maybe a little bit on my fingertip. Like that. I'm just gonna be applying it gently. Tap, 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 tap. Okay. Yeah, you know, it's never nice to come to the hospital. Luckily, you'll be out of here real soon, so just going to get this bandage. And any bandages at home will be suffice for this, okay? Just to keep it clean. I'm assuming it'll probably heal in about 5 days, yeah. It'll scab, and just make sure not to pick at the scab, okay? Place this gently over your eye. Okay. Alright. How does it feel? Good. Okay. Well, I think my work here is done. Do you have any other questions? In terms of pain medication, just Tylenol, ibuprofen is fine. Yeah, just make sure to take too much of it. Another good thing for your body aches is to take maybe a really warm Epsom salt bath. Just take it easy for a little bit, okay? Okay, well, I was very happy to be your nurse today, and I hope you recover soon. Okay, bye.